All right, Mr. Medellin here, you guys, Mr. M. And today we're actually going to be doing forearm. So we're doing two projections of the forearm. We're doing the AP and then we're going to be doing the lateral. So we'll go ahead and get started with that. We have our patient. They have the gonadal shield sitting on their lap. We have our image receptor here. We got our SID. It's set at 40 inches. And if you've noticed, it says 43, but that's because there's a 3-inch difference between the bucky tray and the tabletop. So that's the reason why we're at 43. But if you were to go ahead and measure this, see if I can pull this down. There you go. All right, it's going to be at 40 inches. So it's still 40 inches. Let's get started with the AP forearm. So I'm going to have you extend your arm all the way down with the long axis of the receptor. This is the long axis of the flat panel detector here. And remember that your forearm is a long bone, right? The radius and the ulnar are long bones. So whenever you do long bone radiography, you have to try to incorporate both joints. The exception to that is if you know the site of injury or the pathology and it's a follow-up. But again, any acute situation, you want to include both joints. So in this case, you have to include your wrist joint and your elbow joint. So this is where you have your distal radial ulnar joint, and this is where you have your proximal radial ulnar joint. So again, I'm just going to go ahead and let you know again that your distal radial ulnar joint is the head of the ulna and the ulnar notch that's on the radius. Okay, so just keep that in mind. Your proximal one, your proximal radial ulnar joint is going to be the head of the radius and the radial notch that's on the ulna. So just keep that in mind. That's usually a big test type question that they ask. All right, so we're going to go ahead. We got the arm flexed. The arm is parallel. I want to make sure that I got about 1 inch on the sides. All right, just like that here. All right, we got mid forearm, and this is going to be your AP elbow projection. For technical factors, I usually use about 2.5 mass at about 62, 64 kV, if that, and that would be the technique. All right, so I'm going to go ahead and show you exactly why we do an AP. So I'm going to have you move your arm out here just for a second, and if you guys can just bear with me here, I have the skeleton here, and this is what you would see. All right, so again, we do an AP because if you were to go ahead and pronate the hand, I want to show you what's happening here. You're going to have the radius, the proximal radius crossing over the ulna. So to prevent that, that's why we do an AP. All right, and again, this is where you're going to have the head of the ulna down here on the bottom, and up here you have the head of the radius. So they're inverted, right? They're not going to be the same area. So this is where you have the head of the ulna articulating with the ulnar notch that's on the radius. Remember, you're never going to find a notch on the same bone. Here you have the radial head, and it's articulating with the radial notch. Then the radial notch is going to be found on the ulna. And again, I just wanted to show you using the skeleton to show you exactly what we have here. Now, for the AP forearm, you want to get your condyles. This is your medial epicondyle. This is your lateral epicondyle here, right? You want to make sure that they're parallel to the IR. Same thing with the styloids as best as you can. All right, so now let's go ahead and continue with the lateral forearm. So I'm going to turn my receptor this way now, crosswise. It's still going to be with the long axis of the part, but I'm going to go ahead and show you exactly. You're going to go ahead and bring this over just like this here, right there. And you're going to turn your hand sideways. You're going to drop your arm as best as you can. There we go. I'm going to open up this collimation lengthwise here. There we go. So this is your lateral forearm. So again, you want to incorporate the wrist joint. And look here. Here's the olecranon. Here's your elbow joint right here. You can see where the crease of the elbow is here. You want to incorporate that into your exposure field. You're going to put your right marker here. I like to do this because when we look at it, it's going to be upward. I know it looks a little bit wide here, but that's okay because I don't want to cut off the elbow joint. I can do this, but I want to include as a little bit more elbow as I can. So again, you put your wrist in a lateral position, and this here is going to be your lateral forearm. All right, so again, we can go ahead and incorporate both joints. You want the wrist in a lateral position. You want the elbow in a lateral position. You want the arm flush, if you can, of course. I know if it's trauma, there's some things that we have to deal with, but again, we should do some videos on trauma and what to do exactly when a patient can't do certain things. I think we'll do that later on. But this is going to be for your lateral forearm. Pretty easy, correct? And that's it. I hope that this helps you.
Hello, everyone, you guys. Thank you very much for watching the videos. I'm hoping that they're helping you out. Please make sure that you subscribe and that you hit the notification bell to be notified about new videos. Again, remember to be good to yourself and be good to others. Thank you.